It is a way of life for millions of Americans living with type 2 diabetes. But our next guest says life can improve for type 2 diabetics by making some changes in their lifestyle.
That's right. This morning we welcome Dr. Tunis Hunt with Hunt for Wellness. Dr. Hunt, good morning. How are you today?
I'm doing well. Thank you for having me.
Of course. We're talking about type 2 diabetes, something so many people battle with. Explain what it is and how it affects the body.
Yeah, so type 2 diabetes is unfortunately one of the most prevalent diseases that plague our country today. It's estimated about 30 million Americans currently suffer with type 2 diabetes, and more alarming than that, about 80 million people are on their way to becoming diabetic, and it's actually called pre-diabetes. And diabetes is diagnosed as a result of too much sugar building up in our bloodstream, and that can create a myriad of different problems, anything from abdominal weight gain to peripheral neuropathy, which is pain or inflammation in the extremities like our feet or hands, peripheral vascular disease, which can unfortunately lead to amputation, blindness, kidney disease, more prevalent for heart attack and stroke as well.
You know, I got some friends who are type 2 diabetics, and many people feel very trapped when they hear the diagnosis that they're diabetic.
Yeah, that's the unfortunate reality for a lot of people that get diagnosed with this disease. They get put on medications or even told some lifestyle changes, yet despite being on these medications, they perpetually get worse and worse and so forth. And that's really unfortunately because the underlying cause of diabetes isn't necessarily being addressed by these medications. There's a misconception that diabetes is actually your body's inability to produce enough insulin. And really what the research is showing, it's not the inability to produce insulin that's happening, it's the cells themselves become resistant to insulin. And so let me just explain exactly what that means. When we eat food, there's a component of food called glucose, which is the sugar molecule, and that's what our body needs to produce energy. And so when we eat that food, that glucose needs to get in our cell. Well, it can't do it on its own. It needs another thing in our body called insulin, and our pancreas produces that. And the insulin actually brings the glucose to the cell, and it's the insulin receptor sites that allows the glucose to come in. Well, when we have tons of glucose due to maybe diet or poor lifestyle, we try to shove all that glucose into our cells. And to really protect itself, the cell says no, no more, and it puts up this resistant barrier. And what medications typically do is they cause the body to kind of override that resistance and bust through that resistant shell. And yes, you get some temporary results, but because it's not addressing the underlying resistant aspect, you continue to get worse despite being on the medications.
Wow.
You explained that very well.
Well, thank you. Yeah, I get to do it a lot.
Wow,
So with that being said, then what is your approach to treating people with type 2 diabetes?
Sure. Well, first and foremost, we go after the root cause, which is the insulin receptor resistant site. And really that two components of that is reduce the insulin surges, i.e. keep the amount of glucose down in our system, and then secondly, help those resistant receptor sites heal. And you can do that with particular dietary changes as well as nutraceuticals, vitamins, and so forth. So we hold people's hand really through that process. A lot of people get these diagnoses and they're told, hey, this is what you have, go home, here's a good pamphlet, go Google, try to figure this out on your own. And most people just can't find or figure out all the steps they need to take.
Now this causes people to have a different outlook on it and to totally renew their mind how they think about diabetes.
Absolutely. You know, we see it happen all the time in our office and as well as other doctors across the country that do similar approaches. You know, not only people get better, but we've actually termed, reversing diabetes as part of our outcome because people, A, come off their medications and more importantly, their blood glucose returns to normal if given the opportunity.
That's incredible. You talk about the millions of people who are pre-diabetic. There's a lot that they can do starting right now, too.
Absolutely. Well, first and foremost, it's everyone understands sugar consumption. And when we add sugar to our diets, which is really prevalent out there, it really puts a burden on those cells. What most people don't realize is how quickly refined carbohydrates, your breads, pastas, rices, and so forth, turn to sugar as quickly as you eat it. There's an enzyme in your mouth called amylase that breaks down a sugar called amylose, which is found in those grains, that essentially it's like eating sugar when you eat those things. And so when you just do it moderately even as a diabetic, it perpetuates your problem.
I know, I love those things though.
Yeah, well if you have a good glucose, it doesn't mean you can't have them. It just means if you really want to reverse diabetes or if you really want to get to the point to coming off some of these meds, unfortunately it's a necessity for many people.
Yeah. You host free dinner talks to talk about things like this.
Sure.
So people can find out more information. Can you tell us about them?
Yeah, absolutely. Well, we do them all over the region of Charlotte, and it's an opportunity to have people come and get to meet us personally, and more importantly, allow us to show them some concepts, some lifestyle changes and so forth that they can start implementing to hopefully reverse their diabetes or whatever ailment they might have.
And as Dr. Hunt mentioned, his team will work with you step by step. You won't be left to figure it out by yourself. You'll work with them through the whole process. To register for the free dinner talk, visit freedinnertalk.com. freedinnertalk.com. You can also call Hunt for Wellness. The number is 704-588-1792. Again, 704-588-1792. Dr. Tunis Hunt, Hunt for Wellness, thank you very much.
My pleasure. Thanks for having me.
All right, still ahead on Charlotte Today this morning. What's better?